An outbreak of human metapneumovirus HMPV cases began in late 2024. Public attention was drawn when released data showing a significant increase in the number of cases of HMPV respiratory infections during the week of December 16 to 22, 2024. Human metapneumovirus is a virus belonging to the paramyxovirus family that causes respiratory illness, especially in children and immunocompromised individuals. The HMPV outbreak in China has led to a significant increase in cases and has put pressure on the country's healthcare system. Flash characteristics: in mid-December 2024, health authorities in China reported an overall increase in respiratory infections, including an outbreak of HMPV among children under 14 years of age in the north of the country. According to the Chinese Center for Disease Control and Prevention, at the end of 2024, human metapneumovirus was associated with 6.2% of positive respiratory disease tests and 5.4% of hospitalizations due to respiratory diseases in China, more than COVID-19, rhinovirus, or adenovirus. The number of confirmed cases in China is currently unknown. Cases have been reported in other countries, including neighboring regions and more remote areas. Cases have been reported in Hong Kong, where the rate of spread is lower than in the rest of China. In Malaysia, cases increased from 225 in 2023 to 327 in 2024. India confirmed its first cases of HMPV in Bangalore on January 6, 2025. An 8-month-old boy and a 3-month-old girl were diagnosed with respiratory symptoms. Kazakhstan has reported 30 cases, but the number of HMPV cases is much lower than that of rhinovirus, adenovirus, or coronavirus. According to Chinese and international studies, the virus is actively circulating in densely populated areas and poses the greatest threat to children under 5 years of age, the elderly, and patients with chronic diseases. An outbreak of human metapneumovirus has caused hospital overcrowding in some parts of China and complicated the provision of health services. Symptoms of HMPV resemble other respiratory infections, such as COVID-19 and influenza. The most common symptoms include cough, runny nose, fever, dyspnea, headache, sore throat, fatigue, rash, wheezing. Some patients may experience complications such as pneumonia and exacerbation of chronic respiratory diseases. Response measures: Chinese authorities have stepped up efforts to identify and isolate those infected, and have set up mobile teams to test the population for the virus. Strict guidelines have been introduced for wearing masks in public places, regular disinfection of surfaces, reduction of mass events. Additionally, countries neighboring China have begun enhanced border monitoring and have indicated their readiness to develop regional response plans. Prevention: there is currently no specific vaccine against HMPV. For prevention purposes, the World Health Organization who recommends the following measures: frequent hand washing with soap, use of antiseptics, reducing contact with infected persons, observing respiratory etiquette, covering your mouth and nose when coughing or sneezing. These measures can significantly reduce the risk of infection and further spread of the virus. Therapy: patients are advised to rest. Maintain fluid and electrolyte balance through drinking plenty of fluids, and use over-the-counter pharmacological agents to relieve myalgia and reduce hyperthermia in mild forms of the disease. In severe forms of infection, especially in immunocompromised individuals, drugs such as ribavirin are used in combination with intravenous immunoglobulins. Vaccine: the biopharmaceutical corporation Moderna has conducted clinical trials of an experimental drug that is a candidate for a vaccine against infection caused by the human metapneumovirus. This pharmacological agent, created using modified messenger RNA technology, has completed one of 4 stages of clinical testing as of October 2019. Diagnostics: identification and verification of the causative agent of metapneumovirus infection is carried out using modern molecular biological techniques, among which the key role is played by real-time polymerase chain reaction RT-qPCR. This approach is characterized by increased sensitivity compared to traditional RT-PCR, as well as reduced time and resource costs, which makes it preferable for rapid molecular detection of HMPV. In addition, invasive methods such as bronchoscopy and radiological diagnostics, including chest X, RAY, are used. In parallel, the virus can be identified through direct detection of its genetic material using nucleic acid amplification tests or by detecting viral antigens in respiratory secretions using immunofluorescence or enzyme immunoassay.